I was on a discovery call today, which means it's a 20-minute conversation. Did you know, by the way? You can grab an appointment with me for free, just like that. It's called a discovery call with Kayla and West, where we get to talk about, are you the right fit? Am I the right fit for you? Do I have what you need essentially to help you on your health journey, whether chronic conditions or something that you're just trying to optimize and to make yourself basically hard to kill in the longevity of your health. Anyways, I was on a discovery call. I digress, by the way. You can book one at www.kalonwest.com, Kalon West as it sounds.com. Anyways, I was on this discovery call with a very nice lady, and we were talking about hormone therapy, thyroid optimization, and at the very tail end, she goes, by the way, do you know anything about methylene blue? I said, I sure do. Not to rhyme and be a little cheesy, but methylene blue is a very interesting compound that I actually did not know about in its versatility form. I knew about it in the hospitalist space because yes, we do use it. It's actually recognized by the World Health Organization, love them or hate them, as one of their essential medications in this space to treat a specific condition, but also to be used as an antidote for chemical poisoning. So I knew a little bit about it. It's kind of on the crash carts in the hospital space for a good reason. However, in the wellness and longevity space, and then in the outpatient sector of things, methylene blue is a really interesting tool. So I thought we'd talk about what is methylene blue, where did it come from, how does it work, and then what relevant applications may be beneficial for you. So methylene blue, if you are familiar perhaps with maybe about a year ago, Robert F. Kennedy Jr. was on the plane with some of the Trump administration, and he was seen to put blue dye into the dropper, using a dropper in his water glass and then taking a swig with it. That's methylene blue. Methylene blue comes in a dropper liquid form, but it also can come in capsule form if you know the right person to get it from in a compounded pharmacy way. Or you can go online and get what we call like troches, which are kind of like Big Jolly Ranchers that you break off like a chocolate bar that dissolve under your tongue. But the caveat is in the liquid in the troche form, yeah, it's gonna massage with your tissues and your saliva, so you're gonna look like a Smurf on the inside. It will stain your teeth, your gums, and your tongue for a certain period of time. So getting it in the capsular form where you just swig it back with some water might be a relevant use for you if you don't wanna have that blue mouth effect that unfortunately is just what it comes with in the terrain of liquid or troche form. So let's talk about what is methylene blue before I get off on a tangent here. Methylene blue, technically, yes, is a chemical dye. It was used in the textile world for many, many years until it crossed over into the healthcare sector space. And it crossed over into science and scientific research because it was then used as a dye to help look at bacteria, parasites, and yeast under microscope. Then it further evolved into its adaptations for versatility. Excuse me, it was used in World War II with soldiers as an anti-malaria prevention tool and technique. Then again, in the hospital world, like I said, it was used for chemical poisoning. And now in the outpatient space of compounding pharmacies, we use it for a whole host of things. So let me talk about a few of those real quick with you. One suitable adaptation of methylene blue can be for memory and cognition. I would say this is probably one of the most common questions or curiosities that I get as a practitioner as to, will methylene blue help me in this space? And I say, perhaps, let's just see it and try it. Now, a caveat with methylene blue is that there are certain persons that have a genetic predisposition to a condition where their red blood cells can lyse open in the presence of methylene blue. And so I always grab a lab to check for that predisposition. It's called a G6PD level, and it's pretty inexpensive, something around 20 bucks, prior to ever giving someone a methylene blue prescription. Okay, so just know that there's gonna be blood work up front because I wanna make sure that we keep all your blood cells intact. And to this date, cross fingers, knock on wood, whatever superstition you believe, I have not found somebody for which methylene blue would not be approved, but there can be some. So there's a caveat. I would recommend you work with a practitioner if you're going to be dosing methylene blue to yourself. But again, going back now, memory and cognition, one of the most common entry points as to people wondering, well, will this help me kind of eliminate some brain fog? And there are some studies that show that methylene blue can help boost your 5-HT, okay, which is serotonin, and can help eliminate or kind of palliate perhaps some depression that might be going on. but it can also help with memory retrieval, focus, and concentration. And so I have used it in that way. We dose methylene blue based off of your weight in milligrams per kilogram, and so that's relevant. And we do titrate it up. So there can be doses at which works for you versus someone else. And so that's also another reason to go with a compounding route and to work with a practitioner who knows what they're doing a little bit or a lot. On that depression note, I should circle back a little bit. There also have been studies that have shown that it helps reduce stress, reduce inflammation, and therefore reduce neurotoxicity. And so that has been favorable in depression study outcomes. And so that might be another reason, if you're someone who struggles with mood changes, to possibly look into the use of methylene blue. However, caveat, just like there was a caveat on people who might open up and lyse their red blood cells if they use methylene blue, you cannot use methylene blue most cases. If you're already on an antidepressant called SSRIs, SNRIs, and MAOIs, they're all classes of antidepressants in which methylene blue use may not be approvable for you because it might uptick your serotonin to a degree in which you would feel very sick, very ill, with some pretty not so fun side effects. So again, another reason for working with a practitioner when you're considering is methylene blue a right strategy for you or not. So we've talked about memory and mood, cognition, depression. We've also seen methylene blue used as an antiviral preventative solution, not necessarily to stop a cold once it comes on or the flu, but to prevent one through the winter months. There is some research supporting that purpose and use. And then lastly, I should mention that autism and dementia have a little bit of research in this space too as to how methylene blue can be useful. But I would say more commonly, I have also lastly used methylene blue for chronic pain syndromes, where it helps more so with nerve pain in certain persons. Excuse me. And actually, I should mention, I forgot one category altogether. This has really worked for some women in particular, where they have had recurrent UTIs or cystitis, which is chronic inflammation of the bladder cavity. And because methylene blue, one of its elimination routes, or its primary principal elimination route, is through the urine and through the bladder cavity, it actually sterilizes that cavity and therefore can be very helpful and useful as a neutralizing agent against any bacteria or other pathogens that might be irritating to the bladder. And to be honest, I actually have had a case or two where a female who was on repetitive antibiotics for recurrent UTIs and cystitis was able to come off the antibiotics fully and just use methylene blue instead. So that was kind of a godsend to her. So that's a little bit of the gamut of what methylene blue can be used for in the outpatient model for everyday men and women in chronic care, or for selective strategy for antiviral management, maybe for trying something new with a pain syndrome, or maybe to boost your mood just a little bit in your day-to-day along with your cognitive function.